Welcome back to the CritMedic podcast. I'm your host, Dominic Wallenczak, and this week we've got a viewer request for you of what happens next. So you've gotten your paramedic card, and you've gotten your paramedic patch, and now that you've gone online as a provider, what happens next? What's the career progression for you, and where do you go from here? Stay tuned, and we'll cover that in just a bit. So, what now? Or now what? You've gotten your card, you've reached the pinnacle of your career progression. Is there anything left for you? Well, there's a couple of things that you can do. Lots of people will go on and mention that you can go and get your RN, and then you can move on to nurse practitioner, or you can go on to some other field that is also not paramedicine. And I'd like to show you that there's some other options available to you that don't involve leaving the field. So what options do you have available to you once you get your paramedic card? Well, I would say for starters, you should go and get your national registry. Especially if you're not a national registry state, you should consider getting your national registry paramedic certification. In the off chance that you ever consider moving out of state, this will be sort of a golden ticket for you to get out and get easier reciprocity from a number of different states. Not all states are part of the EMS Compact Agreement, which will allow easy state-to-state reciprocity. So the National Registry is sort of like a stopgap measure that will allow you to transition from one state to another, and it's fairly well recognized on a national level. It adds a certain degree of credibility to say that you are now a nationally registered paramedic as opposed to just an individual state. So once you get your National Registry, there's still some additional courses that you can take that will really help you in your individual practice. And one of those that I found to be useful and beneficial is the Advanced Medical Life Support course from the NAEMT. Now, this course really isn't anything revolutionary, and it's a great course that encompasses everything that you've learned in paramedic school and helps you put it together into an easy-to-follow differential guideline. You follow different organ systems and different pathologies, and you come up with differentials for the symptoms and chief complaints. It really helps to put it together and frame it into a more logical context and help you progress to treat the patient under the presumptive diagnosis that you deduce. So I find that the Advanced Medical Life Support course is really beneficial at helping rehash that material and reinforce it. Now, obviously, you get out of this what you put in, and it also is highly dependent on the instructor. I've taken this course more than once, and in one of those instances, I had a phenomenal instructor. And in another such instance, well, one of the junior instructors was reading the PowerPoint slides in a very monotone voice and moved on from topic to topic and really didn't modulate his voice at all. And as you can imagine, it was probably one of the worst courses that I've ever taken. So if you find the right instructor, this course can be a phenomenal assistance to you in your daily practice and any level of paramedic. So beyond that, I would say another course that's useful is the Difficult Airway course. Now, this course is geared towards providers who can do things like RSI, and that's not available everywhere. But overall, it's a great course to help you consider the difficulties and some of the more perilous intubation circumstances that you could encounter. This is not something that's typically covered in most paramedic programs, and it really helps to reinforce some of the key concepts of intubation. We really need to be masters of this. Overall, paramedics seem to do a good job in meta-analysis of intubation success rates. We've got a fairly high intubation success rate. But in recent studies, the intubation success rate was fairly poor at 50 to 60%, which might explain why the LMAs and King tubes seem to be doing better, because we're doing worse with intubation in those particular studies. It falls below the national average according to the meta-analysis. So we need to make sure that each of us as individual providers is up to snuff with our skills. And the Difficult Airway course is one of those courses that could really help solidify your knowledge base in a very specific field. So moving on from that, you can branch out a little bit more. One of the courses that I took that I found to be phenomenal is the CCEMTP course, or the Critical Care Emergency Medical Transport Program. It's developed by the University of Maryland, Baltimore County, and has multiple satellite locations throughout the country. So you can either attend this in Baltimore, or you can attend a satellite location throughout the nation. Now, this is more geared towards critical care interfacility transport environments. And not all paramedics work in that sort of environment. But even so, this program can still be useful to you, even if you just do regular 911 without any sort of critical care focus. And the reason is this gives into a deeper level of understanding of pathology, physiology, and things like lab work. How many times do you go for a call for abnormal lab values? Well, this will help you understand the pathology and what those individual numbers mean, and make you a better and stronger provider. So the next time someone says, oh, hey, they have a potassium of 8, you can recognize that it's not just a number, it actually means something quite significant. So it's a phenomenal course. It's challenging, but it's also useful. There are certain segments of the course that could use a big revamp. At least when I took the program, the 12-lead portion was, well, I mean, it was there. It's one of the kindest things that I could have said about the program at the time. My original paramedic program did a phenomenal job on 12 leads, so that may not be everyone's experience and knowledge base going into this. But the 12-lead portion really wasn't phenomenal in this program. So if you're looking for a course that teaches you great 12 leads, well, this is really not it. This is really kind of a rudimentary education on 12 leads. But beyond that, this actually goes fairly in depth into the labs and physiology, and also talks about some of the lab work and interpretation and the x-rays. So it's a good course to take. And ultimately, it's a bridge course that will get you prepared to take one of the board certification exams. But there's other programs that are available too. You don't have to go to the CCEMTP program. You can go to review programs, such as the ones available through FlightBridge, which is by Eric Bauer, the Pittman course, or the ACE Prep course, which is by Wingfield. Now, these are all good programs. Personally, I recommend the FlightBridge University program. It's a phenomenal program that he put together, and I like a lot of the FlightBridge material. The ventilator management book is out of this world. So if you're looking for a program, I'd recommend FlightBridge, but you know, this is not meant to be a recommendation of any specific course. Find the one that works best for you. Be careful of some of the other courses that I haven't specifically mentioned. There is one that I actually took that actually I kind of felt I was dumber after coming out of the course. There was so much contradictory material, and it really wasn't well put together, so I'm not even mentioning it here. But so what all these courses lead up to is now you can go for a specialty certification. And this is more geared towards some very narrow specific fields and very narrow specific interests. Some of the things that the specialty certifications do is they provide recognition for some of the accreditation institutes, such as CAMPS, which is the Commission for the Accreditation of Medical Transport Services. And they handle things like air medical transport or even some ground critical care transport services. And these are one of the agreed upon standard certifications that's typically sought. So here's some of the things you can obtain. You can obtain your flight paramedic, which everyone is familiar with, but there's also the critical care paramedic, which is more or less the same thing minus the flight component. In fact, I would say that personally I found the critical care paramedic test more challenging than the flight paramedic test, because you didn't have all of the rote memorization of, oh, you have to have this many hours of rotor ring, this many hours as a pilot, this many in geographical familiarization. You don't have to remember, the rote familiarization of these guidelines. You actually have to learn more in-depth medicine to just follow up and do more medical questions. So it gets rid of some of the BS flight questions and actually details more of the medical questions in the critical care paramedic test. But that was just my experience, and obviously your mileage individually may vary. But I took both tests and I found them both to be challenging and engaging. So with enough study that anyone should be able to take that test. But it does take a little preparation. Some of the other certifications you can get is your tactical paramedic, which I'll be honest, I don't really have a lot of appreciation for. I'm not sure as to the direct utility and implications of a tactical paramedic certification. I'm sure hopefully some of our viewers will be able to fill me in on that, but I'm not sure as to exactly the practical application for standard EMS. And one of the new burgeoning fields is the community paramedic. And the focus of Community Paramedic is to seek some of the at-risk populations, the frequent flyers, and try and link them up with their healthcare providers and some out-of-hospital resources to try and prevent the need for them to call back. And to be honest, this is something that a lot of good paramedics will do out in the field anyways. They'll find someone with a chronic health condition and they call 911 because of their chronic health condition. So paramedics will try and get in touch with their primary care physician and see if they can touch base about, ways they can optimize the management of this patient's chronic health condition, diabetes being one of them, but there's many others. And this is something that we've already been doing in a way. But this is more of a focused referral-based program, especially for things like patient goes to the hospital, they get admitted, they get discharged. Now the hospitals have an incentive to try and keep them from having to readmit, because those can be both costly in terms of penalties and costly for the patient in terms of a setback in their overall care. So once you get any of those certifications, one of the programs you may consider is the Neonatal Resuscitation Program, or also known as its previous title, Neonatal Advanced Life Support, or NALS. I don't really like the new moniker of NRP because now it kind of, conflicts with Nationally Registered Paramedic and Neonatal Resuscitation Program, and you don't know which one they're talking about. You have to rely on context clues. But, this is actually a fairly good program that focuses in depth on neonatal deliveries and some antenatal care. And this is not something that we typically see a lot in EMS. From the statistics, if I recall correctly, only about 9% of all deliveries require any sort of resuscitation. And of that, only about 1% requires some advanced resuscitation measures. So this is not something that we use all the time. So it's good to brush up on this knowledge and keep current. Because like everything else in medicine, practices and trends change. So neonatals is one of the sections where most paramedics are least familiar and least comfortable. The typical adage is, no one dies or multiplies in my ambulance, which, we all know is not true, and we can't stop physics and we can't stop medicine, so that's sometimes wishful thinking. But the neonatal resuscitation program can help you be a little bit more competent and a little bit more comfortable with those types of calls. So moving on, one of the other programs you can take is the Advanced HAZMAT Life Support course. Now, I took this one over in Syracuse, and I found it a good course. Personally, I didn't find it anything groundbreaking, revolutionary compared to my initial paramedic education. I was fortunate that my paramedic education really did cover a lot of this material, but it's always good to review this material and learn new upcoming trends. If you remember, just recently I had a podcast about a patient who had a polypharmacy overdose. And a lot of those considerations are things that are covered in the Advanced HAZMAT Life Support course. So if you're looking for a way to expand your knowledge, especially for overdoses and hazmat toxicological emergencies, AHLS is actually a decent course to take, and one that I would recommend. Another program that I took, which I'm kind of indifferent on, is the Paramedic program. Now, I took the Paramedic course with the intention of, all right, in some more rural and farm situations, you have some unique medical and traumatic emergencies that you could encounter. You've got different pesticides, you've got chemicals, you've got different ways farmers can get injured. And while this course does cover it to a certain extent, it really doesn't go that in-depth into the medical portion of it. In fact, the person who was teaching the program, while knowledgeable, wasn't a paramedic, and when we got to a lot of the medical slides, he just would take his presenter, just flip around, just some medical slides for those medical folks, and nothing you need to worry about. And I'm sitting there in the back, and like, hypothetically, if I was one of those medical people, what would I need to know in this instance? The responses were things like, just diesel bolus, etc., which is really not overly helpful. But the program really does help to open your eyes into some of the emergencies that farmers can encounter. I thought, farm, how dangerous can some plants be, right? But we actually learned that there's a lot on a farm that can seriously and grievously injure you. Combines, harvesters, they all have a lot of sharp parts and a lot of, strong mechanical forces involved. So this program is really more focused on farm rescue and farm firefighting, rescue from grain silos and things of that nature, and extricating people from farm equipment. So I think maybe a better title would be farmer fighter, maybe, or farm rescue, because it's very light on the medical portion of it, and that's really all I can say about it. Not a bad program. It's something good to be familiarized on, but it's not one that I would repeat and take again myself if I had the option. One of the other courses that I took also was the NAMC instructor course. Now, I found this course to be very engaging and very entertaining, and you do learn a lot of the evolving trends in some educational fields. They talked about the different types of learners, which there's a debate as to whether that's really validated or not. But they do talk about the NAMC instructor materials, things you need to learn about teaching a course, instructing. Honestly, I wish I would get more into doing PowerPoint slides and how not to read, slide by slide, and how to use it more as a visual aid while you're delivering more of the content directly yourself. Because slide reading, unfortunately, is boring and ultimately counterproductive. But the NAMC course, I don't have any direct desire to be an educator. My intention is more to be kind of a guide and a mentor, if you will. And I thought that this would be a course that would be beneficial to help me mentor new young paramedics as they enter the field. So the NAMC course I enjoyed, and especially for anyone who wants to go down the education route, going through the NAMC route is highly recommended. So those are just some of the courses that I took. Doesn't mean that you have to take them, but what are some courses that I might take in the future, and what are some courses that you might consider for yourself? So some of the courses that I took, or would look at taking rather, would be some of the NAEMT merit badge courses. Now, they don't like to refer to them as merit badge courses, but really what they are is compartmentalized, modular education sessions. And they focus on different select and specific topics. It's a substitute for a full formal education, but at least it provides, a specific focus of education. And some of the topics that I find would be interesting would be things like geriatric EMS, or better known as 80% of our call volume, really, when it comes to EMS. Now, I'm not sure what exactly it differs from what we do on a regular basis, considering this is the majority of our clientele. But I'm interested in taking the geriatric EMS course and learning more particular information that could be beneficial to the majority of our patients. Also would look at taking things like the psychological trauma in EMS patients course from the NAEMT. Part of what people remember, they don't remember how great you read a 12 lead, or how you expertly selected this medication instead of this medication, but people will remember how you made them feel. And that's one of the things that people most often compliment providers on and write letters of recommendation to agencies saying, this paramedic was professional and made me feel so much better about my health status and my condition. Maybe not in those words, but that's one of the things that people will talk about the most. They don't care what you know. They care more about how you made them feel. And that's one of the areas that I haven't always been necessarily the greatest. I have a story for you. Back when I was a brand new EMT, we were stationed in one particular township, and a call came out right around the corner from where we were posted. So, we went right up to the house. It was, a tenth of a mile away from where we were. We go running in with our little lunchbox AED. We go there, the wife saying, hey, I came in, I saw him on the bed, he wasn't breathing, I called 911. We go in, and unfortunately we see that this gentleman has long since expired. He had rigor to the point where when we moved him to the floor, he was kind of seesawing back and forth. It's like, well, I can see that this is not going to be a successful resuscitation. So the wife came in and said, well, what are you doing? Why aren't you helping him? And I wasn't prepared for that question. And unfortunately, the only thing I could think to say is, well, because he's dead. Yep, talk about dropping the ball on that one. But, importantly, I've grown and learned from that experience. And it's still one of those difficult areas to be able to, convey your adequate condolences to someone who just lost a loved one. At times, I'm not sure that there's adequate words to be really able to express that. but it's one of the things that I'd like to improve upon personally as a paramedic. So I'd like to take the psychological trauma and EMS patients course. Another course specifically that I think would be beneficial would be the emergency pediatric care course from the NAEMT. Now, I find PALS is a okay course, but I find that it focuses too much on, okay, well, now the child's dead, here's how you fix that. And it doesn't spend enough time on recognizing a lot of the serious signs and symptoms and preventing their decline. Yes, it glosses over some of the skin signs and recognizing sick, not sick, but it doesn't really reinforce them as much as I would like. And my hope is that the emergency pediatric care course would be more geared towards recognizing the degrees of sickness of pediatric patients and preventing their decline, before we even get to the stage where we're talking about resuscitation. So I'm hoping that that might be a beneficial course, and I'm going to look and see if I can catch that in the near future. Another course to help me improve with pediatrics would be the Pediatric Neonatal Critical Care Transport course. Now, in our region, Pediatric Neonatal Critical Care Transport is handled by a specific team out of the Children's Hospital. So this is not something that I would ever remotely be involved in, except that we are. These are our 911 calls that come in. Now, we don't have an isolate and things like that, but we have these patients that come to us that would be otherwise considered a critical care and facility transport, except there are 911 patients. So in much the same way that the critical care paramedic course helped me improve my regular practice as a paramedic, I'm hoping that the PNCCT course would help me improve my practice with pediatric patients. My goal is to overachieve with the pediatrics and learn way more than I need to, with hopes that when it actually comes time to remember something in a crunch time, I can at least remember a little bit more than I did previously. So my goal is to overshoot, and hopefully I can end up adequate afterwards. But it's not the only course that's available. There is another course that you could possibly take, which is called the STABLE program, which stands for Sugar, Temperature, Airway, Blood Pressure, Lab Work, and Emotional Support. Now, this is, I guess, an alternative or a different program from the PNCCT program, and I believe this is put on by a nurse somewhere else. So I'm not exactly familiar on the specifics on the differences, but it's another option that I may look at in the future, and something that you may want to consider as well. And I'd like to also move into some of the more advanced airway training programs. The difficult airway course is a good primer and reinforces what you already know. Maybe gets you to think a little bit more critically and specific about EMS management of airways. But I'd like to open my horizons a little bit more and learn a little bit more about different airway management techniques. Add some more tools to my my toolbox, and be able to better manage the airways. And there's two courses that come to mind, really, is Dr. Levitan's airway course, which is the Practical Emergency Airway Management course. And there's also the Dr. Kovacs airway course, which is the Airway Interventions and Managements and Emergencies course. Dr. Kovacs is up in Canada. Dr. Levitan usually has a course somewhere down in the Yukon, was it? No, not the Yukon. The Yellowstone, that's where it is. So he usually has a program that he puts on, which I think I'll try and catch at some point. But I think it might be one of those things that will help you learn more about airway management techniques, and then you can whittle down all those things into what your agency has available. So some other courses that I may consider doing in the future is things like wilderness medicine courses through a number of different agencies. Wilderness medicine for me is not a huge area of interest. The most wilderness that I have to deal with is the drive through a lightly populated suburban area. In my per diem job, I do work in a more rural agricultural community, but that's still not wilderness. Where you have a paved road, that's not wilderness. Even stone gravel roads, that's not wilderness. We're talking about being a significant distance into the wilderness, into the woods. Although, from what I've learned, even just being a tenth of a mile into the woods can seem like a long distance if you have to carry someone all the way out. So the wilderness medicine programs that are available are things like the Wilderness Advanced Life Support through the Wilderness Medical Associates, or the similarly named Advanced Wilderness Life Support through the University of Utah School of Medicine. Now these are related and similar and I'm not sure how they're tied together somehow. But they're also related to the becoming a fellow at the Academy of Wilderness Medicine, which requires a number of continuing education hours and things of that nature. So people who are really into wilderness medicine could consider going down the fellow route, but I think ultimately it might not be something that I particularly pursue, since I don't really have a direct applicable purpose for it. And of course, one of the other programs is the Remote Medicine for the Advanced Provider Program. This happens to be a program that is more geared towards some of like the oil field paramedics and paramedics working in some more distant environments. I do have a colleague who happens to work in a rural setting, who this might be applicable for. I have another one who worked at an oil field. I believe they do 2 weeks on, 2 weeks off, but it's something that would be fantastic if you're looking to do that as a career. So that's a neat program that I would look into taking if that's a way that I would look at going, and something that you might want to consider as well. And ultimately, there might be some credentialing through the National EMS Management Association if you want to go the management route. Credentials such as the Supervising Paramedic Officer for people who want to be supervisors, the Managing Paramedic Officer, and the Executive Paramedic Officer, which I believe is also equivalent to the Fellow of the College of Paramedic Executives. Now, I'm not sure that I want to go the management route. I'm not sure that I want to go the education route either. I mean, ultimately, we have to look at it and say, we're probably not going to be in the field forever. You know, our backs have a limited lifetime, our patients aren't getting any lighter, and the stretchers certainly aren't getting lighter either. So, you know, looking at an alternative option for where you want to move up to eventually as a paramedic when you are no longer able to physically do the job might be something that is logical to consider down the road. Now, these credentials are also tied to educational requirements as well. So it's not just like you take a class or you take a course, you take a test. It's actually geared towards formal academic education with degrees. But if you're seriously interested in management, this might be something that you may want to consider. So what is all this leading towards? All signs seem to be pointing that ultimately, if you want to progress your career, you may need to look at doing something like a degree. Whether it's associate's or a bachelor's, ultimately anything would require a bachelor's as far as management or, you know, education. And in fact, a lot of education programs require a master's degree. There was a educational opening I saw posted recently over on EMS World for the director of paramedic education over at the University of Maryland, Baltimore County, UMBC. That'd be a fantastic opportunity, but it does require you to have a master's degree. So if we want to progress our career into education or into management, we need to look at pursuing our further education in a formal academic setting and getting that degree as a bachelor or master's in either education or in EMS administration or public health administration. So that's what it really boils down to. But as you can see, you know, there's a lot of options that are available once you receive your paramedic patch that doesn't involve you going out of the field of EMS altogether. You don't have to move into being an RN in order to progress. And I wanted you to be able to see that there's other options that are available to you to continue your EMS career. You know, paramedic isn't the end of the line. There's more to do if you are so inclined. But, you know, hopefully, you know, you may consider doing some of those courses. I found some of those interesting, and I will continue to do more courses whenever they come up. You know, keep thinking differently and, you know, always pursue further education. Until next time.